Good afternoon. Thank you very much for coming today as we provide the latest information on COVID-19, the novel coronavirus infection that has impacted China and spread to many other countries, including the United States. At this time, no COVID-19 cases have been confirmed in Indiana. A total of 15 domestic cases and 45 repatriated cases have been confirmed in the United States. The Centers for Disease Control and Prevention says the immediate risk at this time is still low for Americans who do not have risk factors, such as travel to an impacted area or contact with a person who has had recent travel to China or other affected countries. Global efforts at this time are focused concurrently on containing the spread of the virus and mitigating its impact. However, Indiana has been actively working to prepare for the eventuality that COVID-19 gains a stronger foothold in the United States. But as of now, we do not have people under investigation for COVID-19. That means there are no persons in Indiana who are suspected of having COVID-19, and no one is being tested at this time. To date, the Indiana State Department of Health has worked with our local health departments to monitor more than 60 travelers in accordance with guidelines established by the CDC. The number of people being monitored fluctuates as individuals complete their 14-day monitoring period. Currently, 26 individuals are being monitored in Indiana due to their history of travel or contact with an individual who has traveled to an affected country. I want to emphasize that being monitored simply means that risk factors exist for possible exposure to COVID-19. It does not mean a person is ill or will become ill. None of the Hoosiers currently being monitored show any signs of coronavirus. But the situation with this novel coronavirus is rapidly changing, and I know that can cause concern because we don't have all the answers yet. We do, however, have a plan for how to respond if and when COVID-19 comes to Indiana. The public health response is multi-layered with the goal of detecting and minimizing introductions of this virus to reduce its spread and the impact. The Indiana State Department of Health is putting its pandemic preparedness and response plans into action, working on multiple fronts to meet these goals, including specific measures to prepare the communities to respond to local transmission of the virus that causes COVID-19. An abundance of pandemic guidance that was developed in anticipation of the influenza pandemic is being repurposed and adapted for the COVID-19 pandemic. Simply put, we have done this before and we are ready. That pandemic guidance includes strategies for communication and other measures such as social distancing and other steps that can be taken if a large outbreak were to occur in Indiana. Because there is no vaccine and no treatment for COVID-19, these steps largely focus on staying home and mitigating the risk of community exposure should it be necessary. To be clear, it is not necessary to stay home or cancel events at this time. And we can't say with certainty that that will ever become necessary or what specific development would trigger that. Based on recent CDC recommendations, the Indiana State Department of Health is taking the opportunity to ensure it has the most up-to-date information from healthcare facilities about their ability to care for extremely ill patients and their potential for surge capacity as part of the ISDH response to infectious outbreaks. We've assembled a scientific advisory panel of healthcare providers from around the state to assist with this process and advise us on their needs. We held our first meeting this morning and we're bringing additional stakeholders to the table to ensure that all bases are covered. Indiana State Department of Health has also partnered with state, local, and federal authorities to ensure the latest guidance is communicated, and we're sharing that through a dedicated website, through health alert messages sent directly to Indiana medical providers, and through communications in collaboration with schools, universities, and community partners. We also have established a call center for individuals with risk factors for COVID-19 and their healthcare providers. Our trained epidemiologists can walk through the risk factors with the individual and determine whether additional steps are needed under CDC guidelines. For now, we want Hoosiers to know that the best way to protect themselves and their families is to take the same precautions that you would against flu or other respiratory illnesses. Wash your hands thoroughly. cover your coughs, and stay home if you're ill. We also encourage you to stay up to date on the latest information about this outbreak by visiting the CDC or ISDH's websites. As I have said, there are many questions for which we don't have the answers, but I am confident that Indiana is ready if and when this outbreak reaches our state. Thank you. I'll be happy to take questions.
You mentioned the pandemic response plan is in action. Specifically, what action is taking place at this point?
So that action includes bringing our local state agency partners together with Department of Homeland Security and EMS. It involves reaching out to our other external partners like the Indiana Hospital Association, to our healthcare services across the state, to all of our hospitals. It involves incorporating recommendations from the CDC and helping to provide that information to our local partners. It has involved weekly webinars that we have done with our local health departments across the state and webinars that we have done for providers. It involves multiple meetings that we have already completed, not only with the CDC and with HHS, but also upcoming meetings with our long-term care facilities and other external partners.
It's communication at this point.
And planning, incident command planning.
And so is there any special sort of thought for rural communities who might not have that same access to healthcare providers?
Correct. We work with our local health departments on a regular basis. So every county has a local health department and has providers there associated with that. So we're working with them on our webinars on a weekly basis and engaging them. Two of the individuals engaged with our advisory committee today were local health department officers.
You mentioned a number established for people who think they might show symptoms. What is that number?
I'm sorry, can you ask that again?
You mentioned a number established for people who think they might be showing symptoms.
Well,
What is that?
we have been monitoring 60 individuals in total. We have had only 3 of those individuals that had not only the travel history, but also symptoms that could have made them possible candidates to have COVID-19. All 3 of those individuals were monitored and tested negative.
I'm sorry, can you clarify? I thought you said 26 that we were monitoring.
Right now, the other individuals have fallen off because they've completed their 40 days or 14 days, I'm sorry, of quarantine.
So 34 have been cleared. Only 3 of those 34 were sick, and that turned out to be something else.
Correct. It was not COVID-19.
What's that call center number?
The call center number is 317-233-7125. And it is on our website, and we do have a 24-hour number there also.
Where are the locations of the individuals that are being watched? Like, is there a specific location within the state that there are more than another?
They're all over our state, and they are all being basically self-quarantining in their homes in different counties. And our county local health departments are engaged actively on talking to them on a daily basis, asking them if they've developed fever, cough, shortness of breath, any signs or symptoms. And once they've completed their 14 days, they're free to go about their business. If they do develop symptoms that we think could be suggestive of this, then our local county health departments help to facilitate their evaluation with local health partners.
Social media really feeds a lot of paranoia around this. How afraid of this should people be? Is this more deadly than, say, the flu?
So the mortality rate associated with this infection, the best we can tell, is somewhere between 1% to 2%. The statistics that I've read for flu have been around 0.1% to 0.4%. So yes, more deadly. It seems to be similar to the flu in that it's our elderly individuals that have underlying health conditions that are at the biggest risk here.
Are young people, we think about young people with the flu, are they potentially at risk for this as well?
We haven't really seen that come out of China, but again, we haven't had those kind of cases or numbers here in the United States to really know that.
Is the issue?
Let's say someone in the state does test positive. What are the next steps then?
So if they test positive and they're not ill and need to be in the hospital, they can self-isolate at home with follow-up, again, with the local health departments. There will be a longer period of time because they'll need to be able to test negative for 2 days in a row with regards to the the coronavirus.
There have been studies that suggest that Indiana's public health funding is lower than other states. How confident are you that we are funded and have the infrastructure, the kind of financial and equipment infrastructure to handle kind of the worst case scenario, not, you know.
Well, I feel very confident. I mean, Indiana has already, and Pam was here during this time, handled the pandemic virus of H1N1 in 2009. We have been through the Ebola concerns. We have been through MERS and actually had a case in northern Indiana. We are very well supported for this, and we are not feeling that we are lacking any funds that we need to be able to address this issue. Now, we do know that the federal government is working on getting additional funds for states going forward, because depending on the response that we have for the length of time and how severe that response needs to be, we may need more funds for that.
Could you talk directly to Hoosiers who are concerned? Because I've talked to people on the street pretty much every day who keep asking me, is the virus here? Is it coming? They're kind of waiting for this wave to sweep across the U.S. Talk directly to Hoosiers who are afraid and concerned.
I think that's great, and that's the one thing that I want to do above all else today is to help alleviate some of the anxiety and the fear associated with this. You know, people ask me, is this time to panic? No, it's the time to plan. It's the time to make sure that, number one, that you educate yourself and you keep yourself informed. And I'm not talking about looking at social media and blogs that people put out there. I'm talking about going to ISDH's website or the CDC's website and keeping up with that accurate information that we want you to have. I think it's also an excellent time to reinforce, I know you guys are probably tired of hearing about this, but you know, those personal hygiene things that you can do with regards to washing your hands frequently. Don't touch your face, your eyes, your nose, your mouth. Make sure that if you do cough or sneeze, you do that into your elbow or into your shoulder. And if you're sick or someone in your family is sick, you know, stay at home. Don't go to school, don't go to work, don't spread that virus. It's more likely, as I said, to be influenza virus or RSV at this time. And I think it's a time for people to consider that if we do have a disruption in our normal daily routine and activities, how would you respond as a family? So I think, for instance, in my family, we have a grandson who's just about 2 years old, and pretty much everybody works. And so what would happen if his daycare center closed? And we have a son who's actually a speech and hearing therapist for school, so maybe he could take over that watch. So what are your alternate ways that you can manage changes at work, changes at school, changes at your daycare center? And again, hopefully we'll never get to that point, but just having that plan in mind.
Given what you've seen so far and what you know so far, is it a question of if coronavirus reaches Indiana, or is it a question of when?
Well, I would say the CDC thinks it's a question of when. I think that, you know, we are preparing for that eventual possibility, but it is very hard and truly impossible to predict.
So what does that mean for Hoosiers who are quarantined in other states? What happens when they get home?
So if they've already been quarantined and done that quarantine in another state and been cleared, then they're able to travel and do, you know, their normal routine.
Is there a fear that this thing could be dormant because, I mean, we don't know everything about it just yet?
So most likely this is going to be spread by individuals who are symptomatic, meaning they are, because it's spread by respiratory droplets, they are coughing or sneezing and you're in close contact within 6 foot of that individual. That's the way you're most likely to get infected. As you're probably aware, there have been some individuals that were asymptomatic and tested and they came back positive for the virus, but it's still very unlikely that they're going to be the individuals that are spreading this virus.
Are you looking at people who have just been to China, or all 46 countries, I think, now it's up to?
Right, so right now the CDC regulations are really only for mainland China. So definitely we are waiting on some new recommendations for the CDC with regards to this, but I can tell you that in discussions with our hospital systems and our healthcare providers and our infectious disease experts today, they're not just asking about travel to mainland China. They're asking about recent travel and using that as a part of the information as they assess a patient.
There have been reports in other states about like a shortage of test kits. How many test kits are in Indiana right now?
There are no test kits in Indiana right now. There are only 12 states that are able to test for this. The CDC had some hiccups in the ability with their reagents to be able to have accurate test kits out there. So currently, the CDC has no backlog on testing. They have a couple of labs up and running and about a 24 to 36 hour turnaround. But I just got some good news earlier today, and I think that we may have those test kits in Indiana by the end of this week, so hopefully by tomorrow. And then our lab will work over the weekend to verify the accuracy of those tests, and hopefully by Monday we're up and running and testing anyone we need to test here in our own state.
So how many do you anticipate to get by the end of this week?
I'm sorry, I really don't have that answer. I don't know that.
In my Facebook feed, I'm seeing a lot of non-journalists asking about travel abroad over spring break, a lot of anxiety over that. Oh, I have tickets to Italy. Let me
Right.
emphasize these are not journalists. But what do you say to people, because I think we are heading into a big vacation period.
Right. I think that's a really, really good question. And what I would say is that the CDC has done an excellent job of updating their website on a regular basis with regards to travel recommendations. I would say also individually as a family, if you're traveling with women who are pregnant, who would be more susceptible to have severe reaction to this virus, or elderly individuals who have underlying health issues, maybe you want to reconsider that. But I don't think that at this point in time, that if individuals are healthy and you want to go to the southern part of China, maybe not to Milan, that you shouldn't take your trip and enjoy it.
I have two related questions. The comparison to flu is the one that everyone's making. Are there any differences in the symptoms or the treatment? Is this just something that runs its course if you are infected? What other than the pathogen that causes this is the difference between the two? And second, alluding to what you just said, if you're not in one of those risk groups, and nobody wants the flu or coronavirus, is there any reason to be concerned about, oh, I might feel that for a while?
Well, 80% of these cases we know are mild cases, and so that's very reassuring. But we have seen individuals who don't have risk factors who get sick, very seriously sick sometimes. So there's an impossibility to actually predict. What I would say, your other part of your question, I'm sorry.
Is there any
Oh, the
difference
differences.
either in the treatment or the symptoms?
Right. So yes, there are some significant differences in that the fact that this is a brand new virus, we don't have a vaccine for this. So we can't give you something to prevent this. That is under development at this time and testing, but realistically, it will probably be somewhere between 12 to 18 months before we're actually immunizing our general population. The other thing is that we don't have the knowledge of antiretrovirals or medications that can actually treat this illness. So you know now if you get diagnosed with the flu, if it's early on in the course, they might give you Tamiflu to try to decrease the severity of the infection. We do not have that for the coronavirus, although that also is being studied at this point in time.
The people that you're monitoring, how did you find them? How were they discovered?
So as you will recall, there is only 11 airports in the United States that took individuals back from mainland China. So if they came from the Hubei province specifically, they were quarantined when they came into the United States. If they came from mainland China and they were asymptomatic, they were allowed to continue home and to come into our individual states. And then the CDC and individuals actually let us know about those individuals. So we could let the local health departments know that these individuals needed to be followed up.
And is it a voluntary monitoring process? What if they said, I don't really want to do this?
Technically it is, but we have not had any issues with anybody not being willing to self quarantine themselves at home.
You repeatedly mentioned that this is in fact novel coronavirus. Can you go into the difference between the coronavirus that already existed and what makes this a new strain?
So it just means that genetically, when we look at it, it is a little bit different. The good news is that it doesn't have quite the mortality rate as some of the other coronaviruses we've seen, but there are basic coronaviruses that also cause the common cold. So it's hard to sort out, but our mortality rate, as I mentioned, is somewhere between 1% to 2%. And in most of the cases, 80% of them are going to be mild.
What's the mortality rate for the flu?
So the things that I have read, I read one thing that said 0.4% and another 0.1%. So less than 1%.
There are a lot of people too who are running out and buying masks. And in fact, one of my colleagues said she saw someone in the mall wearing masks. I don't know why. And I know at this point the CDC has said we don't recommend that people
Correct.
use masks. But do you have any guidance on when it might become necessary, whether
Right.
folks should buy masks now so that they have them if that does become necessary? How do you make that calculation?
Right, so first of all, sometimes when you see people in the mall wearing a mask, it's because they're immunosuppressed, maybe they're getting chemotherapy for cancer or something else. But the other thing is that the CDC says that there is not any evidence-based information that shows that the average healthy person wearing a mask around is going to prevent them from getting infected. Really what we want to do is put a mask on an infected individual. So if, for instance, someone was sick at home, as we transport that person to be able to enable them to see a healthcare provider, we might like to put a mask on them. Probably many of you have been to your local family doctor or your internal medicine doctor, and outside the door they have the masks and they have the alcohol, and that's because if you have a respiratory infection, they want you to put a mask on so that you don't spread your infection to someone else.
Going back to the preparedness steps that you outlined earlier, is there any difference between the way we prepare for this versus MERS or bird flu or Ebola or flu, or is there just this is the pandemic response?
It really is truly about a pandemic response. So at the time in 2009, it was influenza, and now this happens to be a coronavirus infection. And so the plan is really very fluid. I mean, we update parts of the plan, we change parts of it, and it depends on where we are in the outbreak also as to what knowledge we have. How severe is this disease that we're seeing, and that adjusts what we do in the plan. How widespread this is. It does differ quite a bit from Ebola. We're very glad we're not dealing with that.
But leaving that aside, it's essentially the same thing regardless of what.
From a pandemic standpoint, yes. And I don't want to confuse anybody. The World Health Organization has not yet declared this a pandemic.
What does it require to be called a pandemic?
So basically, you have to have widespread disease globally. You need to have easy person-to-person transmission, and it needs to cause serious illness and even death in individuals.
Did the news out of California last night change things at all?
You know, if that's the case, this will be the first case of community transmission in the United States that we're aware of. We have seen that in other countries, but we do not know how this individual, or California does not know how this individual became sick because they had not had any travel. They had not, to their knowledge, been exposed to anybody who had traveled or anyone who had COVID-19. But again, that's still being investigated, so it's a little bit up in the air.
Specifically with Indiana's preparedness for a response, like if there are a large number of individuals who become critically ill with this, is there sort of a plan in place or like individual facilities? Like just kind of talk about like how that would play out if it were to be, you know, a pandemic situation.
Right. So Indiana has 10 preparedness districts, and they have what's called a healthcare coalition, which is really bringing their EMA officials, it brings their EMS, it brings their local health department and their hospital system all together. And they plan throughout the year for things like a pandemic virus or mass need for immunization for individuals. We also have hospital systems that regularly undergo training and planning for a mass emergency, whether that is a pandemic virus of some kind or whether that is a massive traumatic event where we have a tornado or a flood, some issues like that. So there's a lot of training that goes around through the state, and the important aspect here is that now we kind of pull all those individuals together. If we do have a platform called EM Resource, which all of our hospitals, long-term care facilities, local health departments, renal dialysis units, everyone can be on this platform, and we will be able to keep track of critical access beds. We'll be able to keep track of whether we have more ventilators in certain areas. We'll be able to keep track of hospital systems that may be seeing a shortage in certain types of personal protective equipment. So that is a really good resource that the State Department of Health was blessed to be able to put in the last couple of years, and I think it's going to get well tested this year.
If community transmission is established, whether that's the California case or some other one in the future, how does that change our response?
At this time, in the state of Indiana, it doesn't change what we're doing. But as we go forward and we're seeing lots of community transmission, that's times when we start to suggest things like social distancing and people maybe staying home, especially if there are individuals who are at risk.
I'm a little slow. I'm still trying to keep the numbers straight. We had a total of 60 people in Indiana who have been some sort of risk factor.
Basically had travel that placed them at risk. So we have been following those individuals, and we're down now to 26 individuals that we're still following. And we had a total of 3 individuals that, while they were being monitored, developed some symptoms that could be associated with COVID-19. So they were tested, and they all 3 tested negative. And again, across the United States, 85% of individuals that are being tested are testing negative.
Is there any indication that warmer weather is going to, I know people have kind of said that optimistically.
You know, we don't know that for sure. I mean, sometimes these things just kind of disappear as the weather change and then comes back again in the fall, but we don't have the knowledge about this virus. There's so much of it that we still don't know because it's the first time we've seen it in humans.
Given what you've seen with, excuse me, Ebola virus, H1N1, flu, for any of you, in your heart of hearts, are you concerned, worried, or maybe not so much?
So we're concerned and we're acting on that concern, but what I would say is that the United States has had more influenza deaths this year in this season than all the deaths combined around the world with coronavirus. So I try to keep things in perspective, and I think it's important for everyone else to keep it in perspective.